Tonight, the union on UW-Madison's campus was home to its first free EKG screenings today, giving community members the chance to see if they have any heart issues. Samantha Benish spoke with organizers today about what they're doing.
The Cardiac on Campus organization wants to raise awareness about cardiac arrest, but they tell me that their mission is personal, and today is only the first step.
We mostly just want to raise heart health awareness for everyone, not even just the campus, but the community.
In 2015, Brittany Durenda and Jessica Miller learned that one of their family members had collapsed after finishing a marathon.
They didn't have any sort of resources, AED. He had no idea that he had a heart defect, and he unfortunately passed away.
That inspired them to start Cardiac on Campus, an organization focused on bringing attention to heart health.
There are people who may have never had a history of cardiac anomalies, and suddenly they just drop unconscious out of nowhere.
Today's event was about raising awareness and providing potentially life-saving health care.
So we are doing this to help try to detect any abnormal heart rhythms for students who may not be aware of it.
So I thought, might as well get screened while I can and hopefully catch something early if there is anything wrong.
Cardiovascular disease is the #1 leading cause of death on college campuses, a statistic they say most students don't know.
They don't realize that we're just as susceptible to these kinds of problems as anyone else.
But it can also just be really scary and unnerving not knowing. So that's why this prevention is so important, to try to detect that.
Prevention that could save a life.
So a lot of times with illnesses, you don't really know if something's going bad until it's too late. So getting early screening is a really important thing.
Cardiac on Campus has installed 9 AEDs in UW campus buildings and hopes to install more in the future. UW-Madison is the only Big Ten school that doesn't require AEDs in student housing.